You pee when you sneeze, you pee when you laugh, you pee when you jump on the trampoline with your kids, or maybe you're the one sprinting to the bathroom the second the key hits that front door, praying you make it in time. Either way, you're leaking. And maybe you've been told to do kegels, maybe you've been doing them, maybe they helped a little, or maybe they didn't. Or this is the one that nobody warns you about, maybe they actually made things worse. Here is what nobody told you. There are 3 different types of bladder leakage. They don't have the same cause, and they absolutely do not have the same fix. In this video, I'm going to break down all 3 types and what actually is happening in your body based on which type you have. And by the end of this video, you're going to understand your bladder leakage better than most doctors have ever explained it to you. You have been doing what everyone told you to do, crossing your legs when you sneeze, avoiding the trampoline with your kids, wearing a pad just in case, and nobody has sat you down and actually explained why it's happening. You have been managing a symptom without ever understanding the cause, and that's not your fault. That is a gap in how women are educated about their own bodies. I'm Dr. Gabi, a doctor of physical therapy and a pelvic floor specialist. I have spent nearly a decade treating hundreds of women for bladder leakage, and the number one thing I see walk through my door is a woman who has been managing her symptoms for years without ever knowing the type she has, and therefore never addressing the right problem. Here are the 3 types of bladder leakage you need to know about. And I promise you, by the time we get to type 3, a lot of things are going to click for you. Weak bladder is not a diagnosis. Before we get into the types, I need to clear something up because it is the foundation of everything I'm about to tell you. There is no such thing as a weak bladder. I need you to hear that. The phrase weak bladder just needs to fall off the face of the earth, honestly. The bladder is almost actually never the real problem. Bladder leakage is a pelvic floor dysfunction, and the pelvic floor is a group of muscles, connective tissue, and coordination pattern at the base of your pelvis that actually control the flow of urine. That's the real story. I had a woman come into my clinic who had been wearing a pad every single day for 3 years. 3 years. She assumed she just had a weak bladder. She never knew there was a name for something she was experiencing, let alone a solution. In clinical practice, leaking almost always traces back to the pelvic floor. Either it's not generating enough force to hold urine back, or this is where things get interesting, it's actually too tight and that tension is disrupting the pressure system entirely. The bladder is just the messenger. The pelvic floor is where the real conversation needs to happen. Think of the pelvic floor like a trampoline. When it is healthy and springy, it absorbs the pressure of a sneeze, a jump, or a laugh. When it's worn out, or ironically, if it's too tight and rigid, it can't absorb that force, and urine goes where it shouldn't, and you pee your pants. So if you've been told to just do kegels and accept it, hear this. Leaking is a signal. It's your body telling you something. There is a name for it, there is a cause, and there is a fix. But here's where it gets more complicated than most people realize. Not all leaking is the same, and which type you have completely changes what you should and shouldn't be doing about it. Type 1, stress urinary incontinence. This one is probably the most recognizable. Stress urinary incontinence happens when there is a sudden spike in abdominal pressure, a cough, a sneeze, a laugh, a jump, a heavy lift, and the pelvic floor cannot generate counterpressure fast enough to hold urine back. It is a pressure management problem. Not a hydration problem, not a bladder problem, a pressure management problem. Here is what gets me. This is the type that most women like to laugh off, sometimes literally, but a healthy pelvic floor should be able to handle the pressure of a sneeze at any age, whether or not you've had kids. A lot of the women I treat for stress urinary incontinence are female athletes. Runners, crossfitters, weightlifters, they are in incredible physical shape, but they leak every single workout. And that tells me it is not a fitness problem, it is a pelvic floor coordination problem. And those are 2 very different things. Think of a pressure valve. The moment you sneeze, a burst of pressure shoots downward through your body. Your pelvic floor is supposed to reflexively engage just before that happens, like a quick valve shut, to keep everything contained. In stress urinary incontinence, that reflex is sometimes too slow, not strong enough, or not happening at all. Now, here's the important nuance about kegels and stress urinary incontinence. Kegels can actually help here, but only if your pelvic floor is genuinely weak and under-responsive. If your pelvic floor is already tight and overworked, kegels can make things worse, not better. And knowing that difference means everything. Stress incontinence gets a lot of attention, but the second type is actually more disruptive to daily life, and fewer women know it even has a name. Type number 2, urge urinary incontinence. This is the I've got to go now and I can't make it type. And this one shows up very differently. Urge urinary incontinence is that sudden, overwhelming urge to urinate that's almost impossible to suppress, often followed by leaking before you even make it to the bathroom. What's happening is that the bladder muscle, the detrusor, is contracting too early and the pelvic floor is relaxing too early, making a perfect recipe for disaster. It is a problem driven by a miscalibrated signaling system. Let me ask you something. Have you ever put your key in the front door and suddenly felt like you were about to lose it? Or turn on the kitchen faucet and immediately had an emergency urge to pee? That is called a bladder trigger. And what that tells us is that your bladder has been trained incorrectly to respond to those cues. Here's the piece most women don't realize. Women with urge urinary incontinence are often the ones going to the bathroom just in case before ever leaving the house. Every time you empty your bladder before it's actually full, you're trained to expect it to be emptied at lower and lower volumes. Over time, your bladder starts sending these false urgency signals all day long, and that threshold starts to drop. Think of it like a car alarm that goes off every time a leaf hits the hood. The sensitivity is dialed in way too high. We don't need to make the alarm louder, we need to recalibrate it entirely. And that is critical. Kegels are only one part of the solution for urge incontinence. Doing Kegels in response to an urge can actually break the reflex loop between our brain, our bladder, and our pelvic floor. It can reduce urgency, but there is so much more to reducing urge incontinence than just Kegels. It often involves bladder retraining, looking at triggers, and pelvic floor down training. We need the system to calm down, not dial it up. And then there's the third type, the one most women have without realizing it has a name or a fix. By the way, if you're watching this and finally feeling like someone is actually explaining your body to you, you are in the right place. I put out pelvic health content every single week that makes sense of what is going on down there. Hit subscribe so you don't miss the next one. Type 3, mixed urinary incontinence, the type that looks like both and why one-size-fits-all advice keeps failing you. Mixed incontinence is exactly what it sounds like. It's a combination of both stress and urge incontinence in the same person. You leak with physical activity, the coughing, the sneezing, the jumping, and you also have sudden urgency you can't always control. Both at different times, sometimes at the same time. And here's why this matters so much. A generic Kegel program might nudge the stress component in the right direction a little, but it will do absolutely nothing for the urge component. And in some cases, they might even make the urgency worse. So if you're doing Kegels seeing partial results and wondering why this never is going away, you have a mixed picture. A significant portion of the women who come through my clinic have mixed incontinence. Things have gotten a little better, but it never fully resolves. And that's because you cannot fix a two-part problem with a one-part solution. Think of it like two warning lights going off in your car, the engine and the tire pressure. You fix the engine, one light goes off, but the car is still not right. You don't have any idea why, and that's because you've only addressed half the problem. If you've tried Kegels and seen inconsistent results, better some days, worse others, never fully resolved, there's a real chance you have a mixed picture. This is exactly why a proper pelvic floor evaluation actually matters, because the plan changes entirely based on what's actually driving your symptoms. So now that you know that there are 3 types, here is the most important thing I want you to take away from all of this. You don't have to guess which type you have. The pelvic health world is full of generic advice. Do Kegels, avoid caffeine, stay hydrated, and some of that truly does have merit, but none of it actually tells you what is happening in your pelvic floor with your body. Here's what a proper pelvic floor evaluation actually does. It identifies your type, stress, urge, or mixed. It assesses whether your pelvic floor is too tight, too weak, or uncoordinated. It looks for contributing factors that most people would never connect to bladder leakage, things like posture, breathing patterns, even how you move. And it builds a plan specific to your symptoms. That is root cause care, not symptom management. You wouldn't treat a fracture and a sprain the same way just because they both hurt. The same logic applies here. So tonight, I want you to do one simple thing. Sit down and honestly answer these 3 questions. Number 1, do I leak with physical activity such as coughing, sneezing, jumping, or running? Number 2, do I have sudden urges that feel hard or impossible to control? Number 3, or both? Write it down. That is your starting point. And that is the most important first step that many women never take. When you know your type, you stop guessing. You stop doing exercises that were never designed for your situation. You stop managing around your symptoms and start understanding the actual cause. Bladder leakage is common, but common is not normal, and it is not something you just have to live with, manage around, or be embarrassed by. You now know there are 3 different types, 3 different causes, and 3 different paths forward. The question is, which one are you dealing with? If this video helped things finally make sense, go explore the rest of the channel. There's a lot more where this came from. And if this helped you, share it with a woman in your life who needs to hear it. I will see you in the next one.